Hello lovelies, welcome back. I decided to look into a serial killer I'm not familiar with, and this did occur in history. It was in the 70s that this all kind of occurred. I thought it'd be interesting to research, and the serial killer I chose has the nickname Dr. Death. There are actually two killers with this name that I know of, but I'm discussing the one in Britain. So Dr. Death was a British physician named Harold Shipman. Shipman was born to a working class family in Manchester. He became interested in medicine while he watched his mother go through lung cancer, which I can't imagine seeing somebody go through that. I mean, I've been through breast cancer and the treatments were brutal for me to go through. I can't imagine what they were like back then, and for a child to watch that probably was traumatizing. In 1970, Shipman received his medical degree from Leeds University. A few years later, he became a general practitioner in Todmorden in Lancashire. In 1975, Shipman had been discovered writing several fraudulent prescriptions for the opiate pethidine, which he had become addicted to. He was forced to leave the practice and go into drug rehabilitation. In 1977, he found work as a general practitioner in the town of Hyde in Greater Manchester. Shipman eventually gained the respect and developed a thriving practice. In 1998, one of his patients, an elderly woman, aged 81, was discovered dead in her home only hours after Shipman visited her. The family was confused by the suddenness of the passing since she appeared to be in good health. What was even more surprising was the fact that the woman had changed her will to benefit Shipman. The will stated that Shipman would get her entire estate, which valued at roughly 400,000 euros. Shipman also insisted that an autopsy was not necessary. In 2000, Shipman was convicted of 15 counts of murder and 1 count of forgery. He was sentenced to life in prison. However, Shipman committed suicide while in prison by hanging himself in the cell. In 2005, the government ordered an inquiry to determine how many patients of Shipman may have been murdered by him. An official report found he murdered an estimated 250 people beginning in 1971. 80% of his victims were women. His youngest victim was a 41-year-old man. In most cases, he injected his victims with a lethal dose of a painkiller called diamorphine. Then Shipman would sign the death certificate attributing the incident to natural causes. So no one really knows why he did it. However, there is some speculation that it had to do with the death of his mother. During his mother's lung cancer, he watched doctors ease her suffering with morphine injections. So he could have felt that he was eliminating the pain of his victims. I mean, that's quite possible. However, others believe that Shipman was doing it to rid the population of older people who may be a burden to the healthcare system, or what he deemed was a burden to the healthcare system. There is another speculation that he was killing people because of the power he had over life and death. What is so interesting about this case is how many people he may have murdered without raising any speculation or suspicions of foul play. And it seems that most of his patients appear to be in good health prior to their meetings with him, so it's kind of weird that nobody thought to look into that. Like, why people were suddenly dropping dead after meetings with him when they seemed to be fine, nothing wrong with them. So what are your thoughts on this serial killer? Have you heard of him before? Is this new to you? Let me know everything in the comments below. If you liked this video, don't forget to hit the like button and subscribe for more content. If you want to keep up to date with all future content, don't forget to hit that bell icon so you never miss a new video. Thank you so much for watching. Take care until next time, where I discuss male versus female serial killers, which should be next week. Thanks again. Take care.